Hi, hello. Welcome to the Continuity of Care in Breastfeeding Support Blueprint session at CityMatCH Leadership Conference. I wish we were all in person in New Orleans, but we all have to be safe. So I hope you get as much as you would by being in person. I really would like to kick us off talking about the blueprint. My name is Harumi Riley, and I'm a lead analyst at the National Association of County and City Health Officials. So it was quite a mission in the past 3 years to develop the blueprint with funding from CDC, Division of Nutrition, Physical Activity, and Obesity. We recognized that there was a need for the blueprint because we knew that while most infants start off breastfeeding in the United States, rates quickly drop after birth, especially for families of color. So to change this, communities needed to really understand how to have a community-wide approach to outlining how to continuously and equitably promote, protect, and support families and ensure that they reach their infant feeding goals. So CDC tasked NACCHO and the US Breastfeeding Committee to identify best practices in the field by learning from professionals that have been supporting families for years. We started in the fall of 2018 by reconvening the Continuity of Care Constellation. Group met monthly until summer 2020 to provide inputs, share experiences. We launched national skill surveys to collect broader input, and basically more than 100 professionals from the field contribute to what it turns into the 7 recommendations for the blueprint. So here is to say that CDC funds work priorities in these 3 areas, and they fund NACCHO for community support. There was no approach so on how to do that based on evidence and experience from the field. So that's the rationale for the blueprint, right? So continuity of care already exists in the healthcare field for decades, and it's proven to be effective. So the continuity of care approach aims to create this lactation safety net in the community so families do not fall through the cracks when transitioning from and to a hospital, from a provider to another, when joining child care, returning to work. So here's a little more about continuity of care. So continuity of care exists already, like I said, in different fields like elderly care, children with special needs care, chronic disease, and it's proven to optimize quality care and it's cost efficient. So this illustration here is an adaptation of continuity of care in primary care to lactation support. So on top, you see communication and coordination among various service providers. In the middle, it's like the medical records traveling together from, and family history, both hopefully the birthing person and the child and the baby's charts traveling together from one provider to another, from one setting to another. But we know that this rarely happens in the lactation field, right? How many lactation support providers in the community have critical access to information about birth and infant feeding from the hospital that is super relevant to the post-discharge lactation care? So, and on the bottom, it represents like continuity in care interactions that are fully supportive and culturally relevant to the family. So usually in other health fields, continuity of care mainly communicating and coordinating and warm handoffs transitions among providers and organizations. But for CHAS breastfeeding, there are so many other players, as you see here in this local health system diagram, that influence the CHAS breastfeeding journey. All of these community stakeholders you see here has a role in continuity of care to ensure that families have consistent and continuous access to supportive environments, policies, systems, and we may consider that in each of those, continuity of care needs to exist within each circle and in between each circle. So think about where you are in terms of this diagram. So on the next slide, we just wanted to say that throughout the blueprint, we're using inclusive equity language, and we have a glossary explaining why we're using these terms. A key component of continuity of care is consistent messaging in chest breastfeeding education and in support, both in printed materials and verbal communication. So no matter how fully supportive, no matter how fully established continuity of care is, a community cannot be fully supportive of breastfeeding unless it reflects all families. So here, we're gonna go into the blueprint recommendations. The centerpiece of the blueprint are 7 themes that came up as recommendations by analyzing all the inputs received from the past 2 years, and also by doing a lot of research in continuity of care and community support, try to bridge those. So 4 recommendations you see are related to improving the lactation landscape, the community infrastructure, and the last 3 is to build capacity of the local lactation workforce. So here are the recommendations, and we're gonna dig deep a little bit in each. But first one relates to integrating chest breastfeeding into everything related to community health. The second one is to create lactation supportive environments through breastfeeding policy systems and environmental change everywhere in the community, because we like to say that breastfeeding starts in the hospital or in the birthing center, but the longest journey is actually where families live, work, play, worship, shop, travel, receive services, raise children, and feed children, which is the community. So lactation supportive environments. Number 3 is really the heart of continuity of care. It's the care coordination systems with follow-up accountability, handoff protocols, warm handoffs when possible from one provider to another. So it really requires partnerships, right? Number 4, it's very important, and it talks about the data, local data. It's so hard to find. CDC just released the breastfeeding initiation rates by county, which is great because this is so hard to find. And you can go to the Blueprint website and you can find this new resource because I think it was just launched last month. But developing a shared language, because terms are different from one person to another, and creating like a database so we know what's happening in the community. So those last 3 recommendations are the lactation workforce, so improving capacity or capability to provide broad and consistent lactation support services and education. So let's get started with number 1. So number 1 reads, integrate breastfeeding promotion, protection, and support into existing community health improvement strategies and as a component of health promotion programs. So each recommendation has a set of strategies, and each recommendation has a list of evidence-based references, rationale, and resources to implement those strategies. So this is just a sample of strategies. I believe that recommendation 1 has 6 strategies, and each strategy really could be one whole webinar or one whole conference session. But just to summarize here, those strategies include conducting a community lactation assessment and a community engagement plan with engaging partners and families. This might be familiar for most of you if you're working in the health department, but community health departments do convene the health partners to conduct a community-wide assessment, community-wide health assessment, to understand barriers and assets and what's happening in the community. What are the issues health-wise, the pressing issues to solve, right? So here we say conduct a community lactation specific assessment to understand your rates, to understand who are your services providers, and then developing a community resource or community directory so everyone know where to go, where to refer people, and talk to your families. You're not working for the communities, you're working with the communities. So involve them in everything, co-creating programs and services that actually work for them. The next thing is with this community assessment and whatever you find that is pressing issues for lactation, make sure to work to include this breastfeeding support into community health improvement plans. You can see that some health departments do that very well under including lactation support as a strategy to reduce obesity or to prevent cancer or to in infant and maternal mortality initiatives. And then, of course, not everybody knows the connection of breastfeeding and this risk reduction for other public health areas. So educate providers and include this education in educational materials of other areas so everybody knows. So you really center chest breastfeeding as a health improvement strategy for the community. And then with that, you can start integrating lactation support into other programs like safe sleep and childhood obesity programs, nutrition programs, emergency preparedness plans, and many others. Really, breastfeeding can be integrated into so many other health fields, right? Diabetes. Anyways, so number 2 talks about creating environments that proactively promote, protect, and support chest breastfeeding throughout the community in spaces where families live, work, play, and raise children. So strategies here include organizational policies for employees and for clients, not just the policies, but the systems and the environment too should be proactively supportive of chest breastfeeding. So other family-friendly policies include employee break time, infant at work, school policies, also conducting organizational self-assessment. And some of these recommendations some of the strategies in this recommendation is specifically to clinics or FQHCs and health departments and providers clinics, because the language is very talking about workflow procedures for consistent education and support to pregnant and postpartum families. What is the workflow? So the families that get there for support, then what happens? Who is the next in care? And how do you make a referral among each other? And who has expertise? So all that organized in a workflow procedure. Also, ongoing competency-based training to all staff in healthcare delivery organizations. So training all staff in the policies, training all staff in these workflows and the procedures, providing basic education training for example, in FKHC for the dentist there, or putting a poster there saying that the organization is friendly. When we hear policy systems and environment, we think, oh, that's a lot of stuff, policies, but this is like the internal policies that communities can do it, like the organization itself can really affect change there, right? Also identifying chest breastfeeding champions within organizations, recognition of programs for breastfeeding friendly spaces all over the community, culturally responsive social marketing campaigns, so families see themselves in pictures and images and videos in the community. And then also an innovative one that is starting to happen more is the creation of community donor human milk programs that to improve and ease access to human milk, and also ease donation process. So there's a lot other strategies and a lot other things, but really the specific policy systems and environmental solutions or changes needed in a community will depend on the community, will depend on the family's particular needs and each organizational capacity, right? But it's important to conduct this self-assessment because then you can see if you're actually helping alleviate these barriers or you're contributing to more barriers, right? We had some grantees that did support groups for parents like at 2 p.m. in the afternoon. I mean, most of their clients were working at that time, so is that really helping anything, right? So the next recommendation is 3, which reads implement a care coordination system across the prenatal through weaning stages, including development of referral systems, follow-up accountability, and handoff protocols during transitions of lactation care from one provider to another. We usually think after discharge, which is step 10, right? A lot of families do fall through the cracks there because they don't know where to go. Sometimes there's only a little information package where to look for resources and not very comprehensive. So families end up struggling and discontinue breastfeeding, start supplementing, things that could be solved if they knew where to go or if support came to them automatically without them having to seek help, right? So, but it's not just from the hospital, it's across providers, right? You need, some families may need referrals to other specialties like breastfeeding medicine providers or speech language, occupational therapist, um, chiropractor, or, there's a variety of services that that can be in the referral network, right? And also how to generate like um, automated referrals. So, and then how to even follow up to see if that referral was followed up, right? So, anyways, this one includes strategies for this recommendation includes besides the referral systems and handoff protocols that I talked about, also consistent messaging across providers and institutions. We know that families get so many conflicting advice and then they get so confused and they don't follow any, or they follow the wrong advice. And, so just really being the same page across providers. So this one really requires partnerships between providers, between organizations. Also, another one is creating this resource guide so everybody knows where to go for support and disseminating that through everybody that sees families, right? So they can refer. And lastly, here we have the community lactation coordination role. So we like to say that in the lactation world, there's no captain in the ship, right? Because nobody knows who is responsible for doing these referrals, who is responsible for the education and all that. So it's just creating this structured way that you have someone to go to, like your concierge of services. There's more strategies under this one, but again, this is just a sample. So recommendation 4, local database that we started talking about, how hard it is to find and track infant feeding data, to see where the gaps are, when the families are really discontinuing, and why. Is that a 1 month? Is that a 2 months? Is that a 2 weeks? You're never gonna know that if you don't measure, right? So the idea is to create a community database. And for that, strategies include assessment of existing community level data, standardizing indicators by stakeholders so they decide what you want to measure and what language they're going to use and what it means exclusively breastfeeding. And then when you create a shared database system, you got to create data sharing agreements for the users' rights and how to contribute. And also the electronic health records capability assessments, because there are providers like FQHCs collect this data, WIC collects this data. So how can one system talk to another, or at least how can you pull this data? Like there's, depending on the EHR system that is used, that you can pull up so much important data, but it has to be intentional and planned, right? So the next one, now we're moving to the lactation workforce, right? So number 5 says increase community capacity to provide consistent, tailored, evidence-based lactation education and support by regularly training all individuals who provide services to family. So those include competency-based training, depending on your job, consistency in education and material, integration of lactation education into skilled trade schools, undergrad and grad health-related curriculum, and then also creating a career path in mentorship, especially for Black, Indigenous, and other people of color. There are lactation support providers because there's a need in the field. There is a lot of training provided, but then not necessarily accompanied by a career path. So that's one of the strategies. Recommendation 6 is a family-centered care that is responsible to the intersectionality of families, multiple identities, social determinants of health, and other factors impacting their infant feeding journey. So really, truly using cultural humility approach to get to know the family and share decision making, because it's not our agenda, it's their agenda, their goals. Lots of implicit bias recognition to avoid so heavy biased care. Engagement of family members and the support network in education and support, and also incorporating a universal screening for social determinants of health to see what other needs the family have. And that's why partnerships will be important here, because one entity alone cannot solve all the other needs that one family may have. But you don't know the needs if you don't ask, right? So finally, this one was really driven by USBC, that is to assume a community champion role beyond the provision of direct services by identifying and engaging key stakeholders to help remove structural barriers to chest breastfeeding within systems, organizations, and the community. So it's really connecting to like-minded individuals, because together they're stronger. So connecting to local and state breastfeeding coalition, and really giving voice for the ones that may not have that same privilege, recognizing your privilege, and also amplifying those voices in programs, because sometimes there's one program happening in a little community, but if you don't promote that and share that, people may not know about it, and it might be very good for another community, right? So here's the website that you can download the blueprint. We are also collecting a lot of continuity of care resources. So this is the national repository for continuity of care resources. You can go there and you can download additional resources. And if you have any resource related to any of these recommendations, please submit to breastfeeding@NACCHO.org. We would love to showcase your resource, and I'm sure it's going to be helpful for anyone, for some of the communities implementing the same work, right? We already did a webinar on recommendation 1 last month, so you can go to the website and also find the recording. And then coming up, there's the webinar on recommendation 2 on February 28th. So here's the link to register, but if you go to the continuity of care breastfeeding.org, then you can find all. And finally, we hope that the implementations, we started 10 grantees last week on implementing some of these recommendations, but we really hope throughout the next 10 years that continuity of care in breastfeeding will help increase breastfeeding durations and improve overall community health. We also published an article, which is here, saved in the slides, and I think that's it. Thank you so much, and have a great rest of the conference. Would love your thoughts on the blueprint if you ever get to read them. Thank you. Bye.